is the Emergency Medical Minute.
Good morning, everybody. My name's Ryan Kirch. I am one of the doctors at Medical Center of Aurora. We've been graciously asked by the team of Emergency Medical Minute to start recording at our facility. The topic today is going to be supplemental oxygen when it is unnecessary. So there was a paper that came out in the Lancet in April of this year that looked at 25 randomized controlled trials covering 16,000 acutely ill patients, and that's anything from sepsis, stroke, trauma, MIs, you name it. They were looking at this, and they wanted to see for patients that did not actually require supplemental oxygen, so oxygen's 94% or greater, was providing oxygen a good or a bad thing? You follow me? So they don't actually need oxygen therapy. They're at 94% or higher, but they compared patients that were given oxygen unnecessarily versus patients that were not given oxygen. They actually found that the use of oxygen with a pulse ox room air greater than 94% was associated with increased both short and long-term mortality. With the more liberal oxygen group, they fared worse with both increased in-hospital, 30-day, and long-term mortality. Per 1,000 patients, 11 more will die in the liberal oxygen group in the hospital, and 40 more will die overall for liberal oxygen use. So ultimately, just remember that do not give supplemental oxygen for patients that don't need it. Even if they think they says it makes them feel better, or they're maybe 94, 95%, and you want to see it at 100%, ignore it and leave it alone. This study doesn't actually say what is the cause of this. It was just basically just evaluating liberal versus conservative oxygen therapy. The theoretical thought is that it increases oxygen-free radicals and causes more of an oxidative stress on the system that's already stressed. The other thought is that because you're giving more oxygen, that causes microvascular vasoconstriction, that causes hypoperfusion to organs because of the increased oxygen levels. But again, those are theoreticals. That wasn't proven by this paper. But it is pretty definitive data that shows you if they're 94 or above, just leave them alone.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.